Welcome to Everybody Texas's Title X 101 training. Everybody Texas wants to ensure that all our subrecipients and their staff have the tools they need to be successful in implementing Title X services at their clinic. So whether you are new to Title X or just here for a refresher, this training will tackle the basics. Just a quick note, this training recording can count as Title X training in place of the Title X orientation on the Everybody Texas training checklist. While this training will not cover all of the requirements of Title X your agency is responsible for, it will provide basic information about what Title X is and how it's supposed to work at your clinic sites. We're going to focus on the foundational requirements for providing Title X family planning services, and we'll walk you through a few basic scenarios. Finally, we'll note several useful Title X resources. Hopefully, by the end of this training, you will feel a bit more comfortable implementing Title X at your clinic sites and ensuring your clients are receiving Title X family planning services correctly. By the end of this training, you should be able to identify what is Title X and who can receive these services, incorporate key requirements that will set your agency up for success, and align your policies and practices to meet the Title X requirements. Please know that what you learn from this training may present more questions for you, and that's a good thing and to be expected. Everybody Texas is ready to help you answer those questions, and we'll be following up with your agency to do just that. So who is Everybody Texas? Formerly the Women's Health and Family Planning Association of Texas, Everybody Texas was founded in the 1970s as an organization dedicated to increasing family planning services in the state of Texas. As of 2013, Everybody Texas became the statewide Title X grantee in Texas. At Everybody Texas, we believe that all people, regardless of identity or income, should have access to the care and information they need to make the choices that are best for them. Everybody Texas receives Title X funding from the federal government and passes it through to eligible healthcare providers, providing family planning services across Texas, such as the agency you work for. Other than passing through funds, Everybody Texas's main function under Title X is to provide oversight and technical assistance to all Title X subrecipients. Everybody Texas's job is to ensure all Title X program requirements are met. Everybody Texas relies on input from committees, work groups, and task forces to help encourage collaboration between subrecipients, board members, and staff.
Title X is the only federal grant program dedicated solely to providing individuals with comprehensive family planning and related preventive health services. Title X is administered by the Office of Population Affairs, OPA, in the United States Department of Health and Human Services. Title X is not to be confused with state-based programs such as Healthy Texas Women or the Family Planning Program. For while those programs offer similar services, they're funded by the state of Texas and have different requirements for eligibility. Title X is not a fee-for-service program in that clients do not have to enroll. It is not intended to cover the entire cost of services provided to a client. Instead, Title X's funding is intended to support the overall provision of family planning services at a Title X clinic site. Ultimately, the purpose and function of Title X is to ensure that quality family planning services are available to all individuals of reproductive age who want and need them, while removing social, cultural, geographic, and financial barriers to care. Everybody Texas passes through Title X funding to several agencies across Texas who then provide Title X family planning services to clients at their clinic sites. If you are watching this training, that means the healthcare entity you work for and some or all of its clinics are now Title X clinics. Title X clinics receive Title X funding to ensure low-income individuals in the community you serve have access to family planning services. Now let's talk about who are Title X clients. To be a Title X client, an individual needs only to be of reproductive age and be seeking pregnancy planning, pregnancy prevention, or family planning services. Title X does not have an age requirement, so being of reproductive age for Title X purposes simply means the client has the ability to become pregnant or cause a pregnancy. At a Title X clinic, every client of reproductive age who receives a family planning service is a Title X family planning client. It does not matter what insurance or program is paying for that family planning service. This distinction is important because your agency must report all Title X clients to EveryBodyTX, including clients with payer sources such as private insurance, Medicaid, Healthy Texas Women, or other. This can become somewhat confusing because often clinics will designate Title X as a payer source within their EHR. You may use the Title X payer source when a client has no other source of payment for family planning services provided. This practice is completely acceptable, but it does not mean that only clients without a payer source are Title X clients. Again, all clients of reproductive age who receive a family planning service are Title X clients and should be reported to EveryBodyTX as such. So to recap, what is the age requirement for a client to receive Title X services? The correct answer is no age requirement. So to be clear, and we must stress this point, Title X removes the concept of eligibility. Any and every client of reproductive age who receives family planning services is a Title X client, regardless of their payer source. So whether they are Medicare client, have private insurance, or are self-pay, if they receive a family planning service, they are a family planning client. Core Title X family planning services are those that are directly related to preventing or achieving pregnancy. They include contraceptive services, support for how to achieve pregnancy, basic infertility services, sexually transmitted disease screening and treatment, and other preconception health services. In addition, Title X projects provide related preventive health services, such as cervical and breast cancer screening. Other preventive health services that should be offered on site or by referral include screening for lipid disorders, diabetes, and other health-related problems. Some or all of these services are already likely being provided by your agency. As a Title X clinic, these services will continue to be provided, but how clients access them and are charged for them will differ. We'll discuss those differences in just a bit. For now, you should know that these services are Title X family planning services and that any client of reproductive age who receives them at your clinic is considered a Title X client, regardless of their payer source. Family planning services must only be offered in a voluntary, non-coercive manner. Acceptance of family planning services must not be a prerequisite to eligibility for or receipt of any other service or assistance. Also, there can be no residency requirement. Individuals are eligible for services at any Title X site, regardless of home address. Family planning clients are guaranteed the right to choose family planning providers and any contraceptive method without coercion or intimidation. Some ways in which to ensure voluntary non-coercive services include having internal policies and procedures that ensure voluntary participation. Confirm that all project staff is aware of Title X requirements on voluntary participation. This can be done via training. Inform clients verbally and in writing that all services are voluntary and use non-directive client-centered counseling.
It is important to note that a family planning service can occur at any type of appointment. For example, if a client comes in for a primary care visit for a cholesterol check, and during that visit, the provider speaks with the client about their reproductive life goals and contraceptive methods, then that client has been provided a family planning service for the purposes of Title X. Additionally, family planning services can occur in a service site or in the community at what we call non-traditional settings. Examples of service sites where family planning services may be provided include a clinic, a mobile unit such as a van, or other satellite locations such as homeless or children's shelter or a domestic violence program. Examples of non-traditional settings include health fairs, other community events, or a client's home. Because family planning services can occur outside of your clinic, let's talk through this example to see how that would be possible at a health fair. So let's say you're tabling at a health fair in your community to share resources about your services, and someone walks up. It is a young adult who tells you they are looking for a clinic where they can get birth control without having insurance. This is a great opportunity to privately discuss with them about your services, their reproductive life goals, and connect them to family planning services at your clinic. This type of interaction would be considered a non-traditional encounter and can count towards your client count when submitting your data. All clients who receive family planning services who do not have a payer source or who are not using their payer source because they requested confidential services must be charged according to a schedule of discounts, or what you may refer to as a sliding fee scale. Clients receiving family planning services who are charged according to the schedule of discounts must not be charged a flat fee for those services. Instead, the schedule of discounts will charge the client a percentage of family planning services rendered based on the client's family size and income and where they fall on the Federal Poverty Guidelines, or FPL. Additionally, Title X clients who, based on their family size and income, are at or below 100% of the FPL cannot be charged a fee for family planning services. Clients must be allowed to self-declare their income and family size when determining their federal poverty level. Clients seeking family planning services cannot be denied access to these services because they cannot pay or because they may have previous unpaid fees. If a Title X client has a third-party payer source, your clinics should bill that payer so long as the client is not seeking confidential services. You can and should let them know about other programs that could cover the cost of their services and help them enroll if they so choose, but you cannot require them to do so.
Let's look at another scenario, should we? A 15-year-old female comes into the clinic and wants to start birth control. She tells the staff she does not want her mother to know. This client does have private insurance. For this client, you would let her know that under Title X, she can in fact receive confidential services to get birth control and that she does not have to have her mother's consent. After counseling, you'll provide her with a method of contraception. Even though this client has insurance, she has advised she does not want her parents to know that she'll be getting birth control. In this case, you will not bill her insurance, but instead assess her on a sliding fee scale. Because she's an adolescent seeking confidential services, you will base her FPL on her individual income and family size, which for many adolescents is an income of $0 and a family size of 1. You also want to ensure it is noted in her medical record how she wishes to be contacted in order to best maintain confidentiality around the family planning services she has received. Title X service requirements include confidentiality, reproductive life goals counseling, contraception, services to adolescents. Let's discuss the specifics of each. Confidentiality is a hallmark protection of the Title X program. All clients receiving family planning services must receive verbal assurances of confidentiality, including its applicable exceptions. Those exceptions include if a client discloses they're going to harm themselves, someone else, or if someone else is harming them. Title X allows for adolescent clients to receive family planning services, including contraceptive services, without parental consent. This means if you're working in a Title X clinic and an adolescent comes into your clinic to get prescriptions for birth control, they do not have to have permission from their parent or guardian. You cannot in turn notify their parent and guardian. You cannot provide any health record information related to that family planning visit to the adolescent client's parent or guardian. This does not mean, however, that every adolescent will request confidential services. It means you should let every adolescent client know they have the right to confidential family planning services. What that means is that you will not share their confidential information. If adolescent clients indicate they want their parents to be involved, that's wonderful, and you can then share their health information with their parent or guardian. Additionally, under Title X clinics, you do not have to bill a client's insurance if that client is seeking confidential family planning services. So for example, if you have a 30-year-old female who has private insurance through her partner's employer and wants to receive contraception, she does not want, however, her partner to know. You should provide her confidential services and not bill her insurance, but rather charge her on the sliding fee scale. The reason you will not bill her insurance is to avoid an explanation of benefits being shared with her partner who holds the insurance policy. Finally, all Title X clinics shall practice confidentiality when contacting clients. This means you must indicate in the client's record whether or not they wish to be contacted and how. You should also be sure you are not sending letters or balance notices to the clients who have indicated they need confidential services. Another key component of family planning encounters is the assessment of reproductive life goals and/or pregnancy intention. Reproductive life goals outline personal goals a client may have related to pregnancy planning and pregnancy prevention. Providers must discuss reproductive life goals with clients receiving contraceptive, basic infertility, sexually transmitted infection testing and/or treatment, and preconception health services in accordance with the CDC recommendations. One way to engage in that conversation is to use the PATH framework. This includes parenting, pregnancy attitudes, timing, and how important it is to the client to prevent pregnancy. Performing an assessment of sexual history and risk is a key component in assisting the client to select the most appropriate contraceptive method for them. One suggested assessment methodology is the 5 Ps: partners, practices, protection from sexually transmitted diseases, past STI history, and pregnancy prevention. Another service requirement is to provide all FDA-approved contraceptive methods on site. If your agency is unable to provide female and male sterilization and long-acting reversible contraceptives, such as IUDs and implants on site, then your agency is required to have a written referral agreement for clients to be able to get these methods elsewhere. Similarly, if you do not provide pills, patch, ring, injectable hormonal contraceptives, emergency contraceptives, or barrier methods on site, you must ensure that any pharmacy you send your clients to honors the 340B pricing for those methods. Provision of emergency contraception must be provided within the required time frame if unavailable on site. Referrals for methods not provided on site, such as FABM, spermicides, natural family planning, etc., must also be provided for clients who indicate they prefer those methods. Refer to your EveryBodyTX Policy and Procedure Manual for more detailed information on these requirements. As mentioned earlier, one of the hallmarks of the Title X program is the provision of sexual and reproductive services to adolescents. Adolescents ages 17 and younger must be provided individualized family planning counseling and family planning medical services that meet their specific needs. It is important not to assume that adolescents are sexually active simply because they have come for family planning services. Services for adolescents should be provided in a youth-friendly manner, which means that they are accessible, equitable, acceptable, appropriate, comprehensive, effective, and efficient for youth. These requirements include an assurance of confidentiality, counseling on all contraceptive methods, including abstinence, encouraging family, guardian, or trusted adult to participate in sexual and reproductive decisions, providing information and help with skills to assist any attempts to be coerced into sexual activity, and providing information about current partner, relationship, and/or family violence, including available resources and assistance.
Let's take a look at another scenario. A 36-year-old male client is receiving STI testing services at your clinic. He does not have insurance nor the money to pay for the service he received. All right, for this client, you provide him STI testing services. Since he does not have a payer source, you need to get his family size and income so you can assess him on the schedule of discounts to determine his fee. If he does not have documentation of income or family size, then you would allow him to self-declare these. Based on that self-declaration and his FPL, you would charge him according to your Title X schedule of discounts. Since he is unable to pay the full fee for the service he received, you may ask him if he's able to pay a portion. If he cannot, then you add the charge to his account and follow up with him at his next appointment to see if he can pay anything towards his balance. If not, he can still continue to receive family planning services if needed. Everybody Texas views the compliance monitoring process as an opportunity to help subrecipients make improvements which will allow them to provide high-quality services to Title X clients. The compliance monitoring process is a collaborative effort that does not aim to penalize subrecipients, but instead work congruently to create a strong Texas Title X network. Everybody Texas is responsible for ensuring compliance to all Title X requirements, statutes, and legislative mandates. We do this using a variety of methods to ensure compliance across all aspects of an agency's Title X program. Let's review some of the compliance monitoring activities you will learn more about in the Policy and Procedure Manual. Service site requirements include all staff working in your family planning program completing the mandatory Title X trainings within the required time frame, quarterly financial reporting, attendance of 2 staff from your agency at our annual Title X conference, site visits, which occur once every project cycle. Site visits allow us to review policies, procedures, intake forms, medical records, and observe staff. This is also an opportunity for you to take advantage of technical assistance and training by Everybody Texas staff. Self-audits, which occur once a year, except the year you have a scheduled site visit. Agencies are required to submit an annual client education and outreach plan to be approved by the Education Materials Work Group. Agencies must also submit educational materials such as brochures and handouts that were created or adapted for your family planning program to this work group for review. Secret shopper calls are conducted quarterly and serve to inform additional quality improvement and training opportunities. And last, performance improvement plans and work plans help identify internal quality improvement needs for technical assistance. In addition to the previously mentioned requirements, data entry and submission is also required by Title X. All Title X subrecipients are required to submit encounter-level data on all Title X clients. Encounter-level data is demographic and services information that take place at each client visit. Everybody Texas uses the data you submit to tell the story of family planning in Texas and to submit the Family Planning Annual Report, also known as FPAR, to the Office of Population Affairs. Without complete and accurate data, it's difficult to show progress and successes. And data also supports the case for continuing Title X funding and for seeking other funding opportunities to further support Title X subrecipients. Data also helps us identify technical assistance needs. Please refer to our Policy and Procedure Manual for detailed information about data and reporting.
One final scenario to recap. An established client calls in, wants a birth control appointment, does not want it billed to her private insurance. For this client, you will provide her with an appointment. This client should be evaluated on the schedule of discounts based on her self-declaration, and her insurance should not be billed. On a quarterly basis, EveryBodyTX conducts secret shopper calls to your sites. These calls are used to monitor these requirements are being honored. The following are important and very useful resources. The Family Planning National Training Center, which works in collaboration with OPA to provide training and resources that help ensure that those working in family planning have the proper skills and knowledge to effectively deliver high-quality family planning services. They have created training packages that go in depth on Title X requirements, admin operations, financial operations, core family planning services, and quality improvement. We recommend all new subrecipients to visit their Title X requirements training package for sample policy templates and training resources to help support you as you set up Title X services at your sites. In addition to the Family Planning National Training Center, there are a few other very important resources we want to bring to your attention. The National Family Planning and Reproductive Health Association, NEFRA, is our parent organization and a resource for conferences and additional training. As a Title X subrecipient, your organization is a member of NEFRA. The Quality Family Planning, QFP, provides recommendations and best practices by CDC and OPA, the Office of Population Affairs. We highly suggest downloading the mobile app for quick and easy access to pertinent information and guidelines. Bedsider, which you might be familiar with, provides useful tools and resources that you may utilize for supporting your sexual and reproductive health, education, and service provision.
While understanding the main components of Title X should help you successfully implement the program, questions do come up. Our Title X providers work in a variety of different settings and use a variety of different programming to implement Title X. So we totally understand there will be questions and scenarios that come up that you may not be clear how to navigate. In these situations, you should always feel welcome to ask us. We encourage it, and we will do our best to respond to questions and issues in a timely manner. For questions, please contact us by email. Anything related to Title X programming or implementation, please send emails to programs@everybodytexas.org. For questions related to allocations, revenue reporting, expenditure reporting, send emails to finance@everybodytexas.org. For data-related questions, send emails to data@everybodytexas.org. Thank you so much for joining us. Have a good day.